Hello, my name is Amy Sturkey. I am a pediatric physical therapist, and I've had questions about toe walking. So I looked around through the social media and found somebody who has a child who has toe walking. So this is Stephanie, and she is Lindsay's mom, and Lindsay's going to be one of my co-instructors. And I thought I'd start off with the kind of questions I ask in an evaluation. So one of the things I want to know about is just the history. Can you tell me about Lindsay's birth history? Was there anything significant with her birth?
Nothing really significant with her birth. She arrived on time. The only issue that she's had medically is that she has had several instances of ear tubes, ear infections, constant. Her tubes eventually created a hole in her ear.
Wow. And
she actually had to have surgery a couple months ago to remove her tubes and fat replacement in the holes in her ears.
Wow. Okay. And developmentally, when did she walk early or late?
She walked early at 9 months.
So she walked really early.
Really early.
And when did she start toe walking?
She probably started toe walking by 3 or 4.
And so she didn't toe walk at first. She developed it over time.
Yes.
Okay. And developmentally wise, the other gross motor skills, have they come in normally?
Absolutely. Everything else has been totally fine with her.
And what about just her balance in general?
Her balance, she does seem to have a lot of balance issues, and it could be, related to her ears because she's had a lot of trauma to her ears. But as far as like just walking, she seems to trip a lot, fall a lot of skin knees and falling on her bike.
And what percentage of the time would you say that she walks on her toes?
Probably 90% of the time.
90% of the time. And is it something that bugs her that other people mention and she doesn't want to do, or?
It doesn't seem to bother her at all. She seems to enjoy tiptoeing around, but so many people, friends and family, have commented on her toe walking.
Have you ever asked her, can you put your heels down, and can she walk with heels down if she tries?
And she can. It kind of depends on what shoes she's wearing, if she can step on her heels or not, but for the most part she'd rather be barefoot and tiptoe walking.
Okay. And if you were to ask her to walk with her heels down, how long would that last?
Probably not long.
Meaning less than a minute?
It may be a couple minutes or so, and then she would probably just go right back to how she normally walks on her toes.
Okay. And one of the things we did as a part of this process is I asked her to complete a sensory history questionnaire. So when we looked at the sensory history questionnaire, one of the things we found was that she craves movement, and particularly intense movement. The other thing we found is she was a little sensory avoidant. What were some of the things that you saw in that? That stiff clothes she doesn't like, tags on clothes?
Yeah, we've always had to have her underwear handmade because it's softer. I've never actually bought her a pair of underwear from the store with tags or the little lace. So we've always, since she was potty trained, we had handmade underwear, so it was softer. And she doesn't like sheets on her bed. She always likes a big, heavy comforter. And she's definitely specific about her clothes that she wears.
Okay. And the other thing I didn't ask about was sometimes toe walking is genetic. Have you had anybody in the family that you're aware of that were toe walkers?
Nobody that I'm aware of, just her so far.
Okay. And the other thing was sometimes toe walking goes along with a tethered cord. Has she had any bowel or bladder issues?
She's 6 now, and she still has occasional accidents.
Okay.
Sometimes at night and sometimes during the day.
All right, that's very interesting. I know there was another one. Sometimes speech issues goes along with it. Does she had any speech issues?
We've never had any speech issues.
Have you done anything in the past to address the toe walking?
No, I haven't. Like I said, she's pretty comfortable doing it, and I never really noticed an issue. But I do have some OT friends that saw her walking just the other day, and they were like, "You really should get that checked out." So,
does she have any calluses from walking on her toes, redness on her feet? Any problem with her feet that you've noticed?
No problems really. I mean, she will get red on her feet if she's walking constantly for a long time on her toes, but no bunions or calluses or anything like that. And she does not complain of any pain.
So these are the basic questions I ask when I start thinking about doing an evaluation for a child who is toe walking. I hope this video is helpful for you as you think about your child who is toe walking, to try to determine the issues and the reasons behind why your child might be toe walking. Usually it's either a genetic issue, a sensory issue, a medical issue such as tethered cord, or a neuromuscular issue or neurological issue relating to cerebral palsy or some minor neurological issue. I hope this is helpful, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.